Suspension training has become mainstream as a viable training alternative to using traditional weight equipment. Companies like TRX and Lifeline produce nylon straps with end grip structures that allow for a host of dynamic and ballistic bodyweight exercises, and these exercises can be performed anywhere the attachment site can be properly anchored at an elevated height. The attachment system uses a single anchor, which lends itself to increased rotational inertia and translational forces, dramatically exploiting the stability of normal, closed-chain exercises. The nuances of strap-based training that occurs from varied suspension heights increases total body activation during both single and multiplanar exercises. This is due to the increased demand for body positional management. As one might expect, when the body is suspended, dynamic movements cause a rotational swing, requiring increased core activation to help stabilize the body and prevent undue movements. For this reason, many professionals use the equipment to enhance central and peripheral stability, which translates into improved strength and enhanced movement competency. A suspension device allows for a significant number of exercises, which can be aimed at muscle isolation, create challenges in normal biomechanics when dynamically applied, or be implemented to address movement specificity in efforts to work cooperative muscle systems. From a health-related perspective, suspension training can be used to improve flexibility, muscular strength and endurance, and even cardiovascular health, when the exercises are performed in sequence, using no rest in a circuit-like fashion. It is also an ideal adjunct to fill the gaps when additional equipment is needed for total body workouts. In smaller gym settings, the relatively inexpensive device provides for a host of exercises that traditionally would require multiple pieces of equipment. Additionally, they are great for group exercise classes and at-home training. A caveat to suspension training is there exist limits to safe loading that can be accomplished, so it is not ideal for maximum strength training or bodybuilding. That being said, it certainly can help develop adequate strength for health purposes. In fact, several professional athletes have successfully implemented suspension training as a pillar of off-season conditioning. An important consideration with any piece of exercise equipment is safety. Due to the inherent swing presented by the equipment, it is very important to consider injury mitigation when performing suspension-based activities. First off, the device needs to be anchored correctly. It is not uncommon for suspension anchors to be ripped from the wall during activity. This occurs because the setup erroneously anchored the mount to drywall and not the wall stud. It should always be secured and tested before full use. When connecting to a rack, it is also important to ensure the rack is anchored to the floor or employs safety counterweights so the rack does not get pulled over onto the exerciser. Once properly anchored, the straps need to be set to the correct length for safe and effective exercise execution. In most cases, the two primary considerations are: the length should allow for full range of motion without risk of contacting the floor, and a length should be set where the load-angle relationship is correct for the exerciser. In general, the load angle should be directly opposite the working joint angle. Inadequate strap length makes the exercise too easy, whereas too much length increases the physical challenge but may limit movement range. The next step in ensuring proper safety protocols are met is practicing getting in and out of the device with a spotter. Some exercises can create an overcommitment action, which creates the potential for injury. For instance, an unpracticed chest fly can cause an exerciser to fail and collapse between the handles, which can injure a muscle or the shoulder joint itself. Likewise, when one foot is anchored, injury risk increases as there is limited escape, so practicing the setup and dismount with a spotter can attenuate some of these potential problems. Before using suspension equipment, one should go through a safety check to make sure prerequisite strength and flexibility exists to avoid injury due to heightened stability requirements. Some foundational system checks include being able to perform bench push-ups, 45 to 60 degree supine rows from a stable bar, and holding planks from a straight arm position with the feet on an elevated surface. Likewise, one should be able to attain greater than 90 degrees of horizontal abduction and be able to attain full shoulder flexion on both sides of the body. If these are all attainable, then one should be ready to start introductory exercises using suspension equipment. Suspension training offers significant utility for improvements in flexibility, or more specifically, mobility. Due to the 360-degree capabilities of the device, the fascial slings can be exploited for dramatic improvements in movement over time. Additionally, the anchored position allows for increased torque on the tissue in different positions. Let's take a look at some mobility applications. The chest stretch requires the exerciser to assume a standing T position with a pronated grip. Next, take a broad step forward, easing into a deep lunge position with an extended spine and contralateral hip. To increase the range of motion, use a forward movement to attain greater hip extension and increased horizontal abduction of the shoulder. This can be accomplished across a range to fully stretch the pectorals and internal rotators. The shoulder stretch works in a similar fashion as the chest stretch, but the arms start and are maintained in a lower position. The lunge progression is the same, but rather than extending the spine, the trunk leans forward to increase the stress on the deltoid. The chest should remain elevated during the lengthening phase. The arms can be internally and externally rotated to change the lengthening characteristic across different aspects of the shoulder complex. The lat stretch in the sagittal plane also uses a split stance position, but now the shoulders are fully flexed. The stretch relies on a broad forward lean with an extended spine position. The trapezius should remain neutral so as not to adjust the scapula, inadvertently reducing the stress. The arm should be fully extended so as not to direct the stretch to the internal rotators. The combination of low back and hamstring can be stretched together since they are incorporated into a functional sling. The movement starts from a standing position facing the straps and then assumes a progressive hinge action. The heels will remain static as the hips migrate backward with the legs extended and trunk flexed. Contracting the quads and rectus abdominis will benefit the stretch through reciprocal innervation. To increase hamstring range of motion, the pelvis can be migrated back to neutral and the ankles actively dorsiflexed, which will also draw the gastrocnemius into a lengthened position. To stretch the rectus femoris and iliopsoas, the exerciser will perform a Bulgarian squat from the straps. The position of the body can be adjusted to a tight vertical alignment to place greater stretch on the quadriceps, or the hip can be extended further to place more emphasis on the iliopsoas. If an exerciser has difficulty with either, they may be assisted by a stable device such as a plyo box or bench. In either case, contracting the hip extensors furthers the stretch potential. The glute and piriformis can also be stretched in pairs. The exerciser must assume a figure 4 position by internally rotating the hip and crossing the contralateral leg. The knee and hip should be flexed simultaneously as a deeper squat position is attained. Arching the back places further stress on the stretched tissue. As mentioned earlier, the suspension tool allows one to stretch whole fascial lines and sling systems of the body in an integrated fashion. The lateral lean stretch addresses the hip abductors, obliques, and latissimus dorsi in the frontal plane. The exerciser will use a dual neutral grip and split stance to laterally lean into the greatest attainable range of motion. The humerus must remain behind the head for the stretch to optimize the fascial torque. Another lateral system stretch uses a crossover maneuver where the back leg is adducted behind the front leg. This places an increased stress upon the lateral flexors of the trunk and abductors, as well as the contralateral glute medius. The tension is increased with lateral flexion, which also incorporates the ipsilateral latissimus dorsi. As a suspension training instructor, it is important to recognize how each exercise challenges the body and ways to make each exercise easier or harder depending on the capabilities of the client. In most cases, it is the degree of horizontal positioning of the body that determines this outcome. For instance, a row or press are much more challenging the more parallel the body is to the floor, as the total of one's body weight involved increases with a reduced body-to-floor angle. Therefore, to make exercises harder, we lengthen the suspension straps. To the contrary, when we shorten the straps, most exercises become easier. Additionally, much like traditional free weight exercises, the longer the resistance arm, the harder the exercise, whereas a shortened resistance arm makes the exercise easier. Therefore, a chest fly is harder than a chest press, as the arm length is greater in the fly than the press. It is a factor of mechanical advantage and adjustments to peripheral stability. Programming suspension exercises follows the same order of operations as traditional exercise programs. Following a comprehensive warm-up, the first group of exercises are ballistic in nature, particularly those that use the most muscle mass and body weight. If no ballistic exercises are used, then those that are the most difficult for the exerciser to perform should be initiated first. The rationale is hard exercises should be done when the body is fresh and not fatigued. An example would be suspension jumps, followed by M-pulls, followed by suspended push-ups, ending with a plank to trunk flexion. If circuits are used, the sequence should also follow the hardest to easiest concept so the technique is properly performed during the sequencing. This is where there may be some adjustments between exercise order among different sexes. Since a female's upper body strength ratio is lower than males, certain exercises may warrant upper body work before lower body training activities. Also, those with less stable joints may sequence accordingly, so that a maximal effort can be employed during the most challenging exercises. This may use a back pull, chest push, shoulder press, and trunk flex or rotate sequence, which may look like pullovers, to push-ups, to T-pulls, to prone trunk rotation. Another programmatic consideration is the teaching and learning aspect of training instruction. As stated earlier, the ability to regress and progress exercises to match the exerciser is important for safety, effectiveness, and proper program adherence. This suggests showing the easiest exercises and ensuring they are mastered before progressing them. During progressions, it is vital to observe technique for any undesirable compensation or movement faults. A common example of a progression model would be high-angle push-ups, before lower angle push-ups, before press reaches and flies are introduced at high angles. Once each has been mastered, they can be sequenced to add muscular challenges such as flies supersetted with push-ups during a chest workout, or T-pulls supersetted with low rows for back training. In traditional resistance training, these would be reversed. But again, the long resistance arm positions create significant challenges under suspension. When programming for the whole body, the integration of exercise movements starts to look at fascial lines and bodily planes of joint action. lunges with rotation, pullovers with knee flexion, push-up pikes, and low to high squat pulls all use total body musculature to perform. The integrated program model is excellent for mobility, strength balance, improved stability, and metabolic conditioning when sequenced in circuits. Many programs employ sagittal or frontal plane exercise mixed with transverse movements, thereby joining functional systems. This approach provides the broadest of adaptations due to the integrated approach. Again, this is not ideal for bodybuilding or maximum strength training, but neither is suspension equipment. If mass is a goal, then the programmatic concept must look at total time under tension. For instance, a leg day may use overhead squats, reverse and lateral lunges, Bulgarian squats, and leg curls, accumulating at least 11 sets per muscle group. Upper body exercises can be managed the same way. On a back day, one may use M-pulls with transverse and sagittal plane rows and pullovers. Generally speaking, when increased mass is a goal, the overlap of muscle-specific exercises should be between 4 and 6 exercises per group. Due to the lower intensity of load used, the volume is needed to trigger an adaptation response. So, regardless of the goal, programs can be adapted to meet any particular adaptation. Again, the caveat is, regardless of the focus, the training must meet the threshold for adequate stress so that improvements are continuously made. With most upper body suspension training exercises, keeping the upper body in a straight line is essential. This means the inner unit or core muscles are engaged, keeping the spine and pelvis neutral. The glutes are firing to keep the hips forward. The quads are actively keeping the knees extended, and the head remains in a neutral position. The feet will generally be placed hip-width apart. An exercise will only deviate from this position if specified for a particular purpose. For the first set of exercises, we will look at upper body pulls and rows. Here, the exerciser will be facing the attachment, with the heels anchored to the floor and the entire body angled about 45 degrees. Beginners can start with their feet further from the anchor, making the body more upright and subsequently reducing the resistive pull requirements. Let's start by examining how to perform low rows. From the start position, initiate the movement by retracting the scapula while pulling the elbows out, back, and down, all while depressing the shoulders to reduce upper trapezius involvement. The thumb position finishes at the lower chest level. One's grip will rotate slightly from a pronated start position to a neutral finishing position. There should be no other joint movements, especially at the hips, knees, and neck. Finish by returning to the start position slowly using a controlled speed. The most common errors include elevating the scapula and having the shoulders anteriorly migrate. If this occurs, cue the lifter on each body part. Retract the scapula while pulling the elbows back and down, and keep the thumbs to the bottom of the chest. Flexing the hips. If this continues to occur after cueing, the individual most likely does not have the required upper body strength to complete the movement. Modify the exercise by moving the feet further away, allowing the body to be more upright. And pulling too high. This is another common error for beginners. They will perform more of a face pull than a row. Cue to pull the elbows out and keep the thumbs at the bottom of the chest. The inverted row, or modified pull-up as it's sometimes called, is actually a low row in the lowest attainable supine position, as the straps will hang almost straight down. This requires the exerciser to assume a squat position and then walk the feet forward while completely extending the arms. The body should hover above the floor. From the start position, the exercise is performed consistent with the low row and is initiated by retracting the scapula while pulling the elbow back. Similarly, the goal is for the thumbs to finish at the lower chest level. One's grip will rotate slightly from a pronated start position to a neutral finishing position. If the extension is incomplete, the exercise is too difficult, which can be easily attenuated by flexing the knees. This cuts the resistive forces in half and should accommodate most intermediate lifters. Once the terminal position is reached with extended arms, the exerciser will return to the start position in a controlled manner. The leg position of the inverted row can be manipulated to make it easier or more difficult. For instance, crossing the feet reduces the anchor and increases the tendency to rotate, whereas crossing the knee with a straight leg adds to this challenge. By simply shortening the crossed limb distance, the rotation can be attenuated but still create an added challenge to the traditional position. When the row is moved from the sagittal plane to the transverse plane, the muscle activity of the exercise adjusts with its grip choices. Whereas a neutral grip reflects the most traditional approach, both pronated and supinated grips are commonly used to vary arm involvement. The pronated grip reduces bicep activation in exchange for a more active mid-back, whereas the supinated grip increases bicep involvement. Many newer exercisers find the neutral and pronated grips to be easier as they can better access the flexors of the arm. Varying the grip across sets of these exercises ensures all the muscles of the back that assist in transverse force production during horizontal abduction are worked equally. Another type of row uses a single limb anchor, called the single arm T-row, or archer as it is known. The exercise employs more total body involvement to assist the row action with momentum-driven rotation. Here, the exerciser performs a one-arm row while simultaneously reaching and rotating the free arm to the strap. Again, the momentum helps with the movement, so absolute brute strength is not necessary by the anchored limb. One caveat to the attenuated stress is the body must accelerate and decelerate in a coordinated fashion to complete multiple repetitions of the archer. The suspension device can also be used in more ballistic applications. Take the muscle up as an example. This challenging ballistic row integrates the pulling of a row with extension of the arms. The lats and triceps actually function in an integrated fashion during low horizontal abduction and extension of the arm and shoulder, making for synergistic movements. The row portion of the movement is accelerated using ballistic contractions and converted to shoulder and arm extension to finish the exercise. Both upper and lower transition points use deceleration so as to control the body at the top and bottom positions. Similar to the other rows, the closer the feet are to the anchor point, the harder the activity becomes from a force, demand, and control perspective. We will now examine a number of functional movements, starting with the overhead squat. The overhead squat is less challenging using a suspension system compared to free weights from an intensity standpoint, but the coordination required to execute it with perfection increases its demands. For novice users, the best thing to do to identify proper foot placement is to assume a squat position, and then raise the hands overhead with the straps and adjust until the straps are properly tensioned, reflecting a perfect overhead squat position. Common errors during the overhead squat include disconnect between the upper and lower body during the descent. This is the most challenging aspect of the exercise, and fixing related errors can be facilitated by moving slower or even inch by inch. Having an improper trunk angle. This is caused by not starting in the right position. The bottom position should look just like an overhead squat and not a back lean. Practicing the action and terminal position without the straps helps to find the proper foot position. Movement errors due to flexibility limitations. If one cannot perform a good bodyweight squat or overhead squat with a dowel rod, you should not be prescribing the suspension overhead squat. And improper arm positioning. The elbow should be fully extended and the arms in the same position as a Y reach. The suspension system can be used two separate ways to perform Bulgarian squats, and one is certainly easier than the other. The easier technique is to perform the Bulgarian squat with the rear foot on a bench while using the straps for support during the pull. The harder way is to put the foot through the handles and perform the Bulgarian squat freestanding with a descending arch swing. This method is advanced and should only be used with clients who are fully capable of balancing on one foot. A test exercise is to perform a Bulgarian squat with the rear foot on a physio ball. This will teach the same frictionless movement, but with some continuous ground contact. You can also assist the exerciser by holding your hands out for balance during the movement. Practice this first, and then try to slowly remove support. A large plyo box to help stabilize will also work. Common errors during Bulgarian squats can include dropping straight down instead of letting the hips travel back. This is often caused by a lack of confidence and stability. If this occurs, regress the movement by adding some support and cue the hips to travel backward and downward. In some cases, tight hip flexors are the problem. In these cases, adjunct stretching is needed. And medial lateral swaying, which is caused by instability at the trunk, hips, and/or lower legs. Let's continue by looking at the lunge pullover. The start position for the lunge pullover is similar to the push-up. As you lunge forward, raise both arms so that you finish the shoulder raise position at the same time as the lunge, in a full eye reach with a pronated grip. A key goal to this drill is to use the upper body to assist in the lift. As you lunge forward, don't just raise the arms, but press into the handles with your palms. This will help activate the lats and decelerate the movement as you reach the end of the range of motion. The same concept applies to the ascent. You should be actively pressing your palms into the handles to guide you back to the start position. This will train the posterior oblique sling. The exercise can also be adjusted to a T or Y reach depending on the muscle activation desired within the program. The only variation in grip occurs in the T reach, as it maintains a neutral position throughout. Common errors for this exercise include not controlling the descent or assisting the ascent with the arms. To fix this, actively press down on the handles throughout the entire exercise. And short stepping. Add a visual cue like a cone to assist in your foot placement. You can also use tape on the floor. Let's progress with the leg curl. To be effective in total hamstring activation, the suspension leg curl starts from an active glute bridge position. This can be either with the knees slightly flexed or extended. Most exercisers find it easier to start with the knee flexed. To initiate the movement, slowly flex your knees while elevating the hips with a neutral spine. Contracting the glutes and bracing the trunk maintains proper positioning. Once full hip extension and knee flexion are reached, reverse the movement by extending the knees to the start position. The knees and ankles should remain an equal distance apart from each other throughout the movement. There should be no hip ab or adduction. Common errors for the leg curl include not maintaining a neutral spine and pelvis. Remember to cue for glute contraction with abdominal bracing. And allowing the toes to point outward. This employs activation of the glute medius, so cue maintenance of straight hips. If the hip extended start position is too difficult to obtain, perform hip extensions without knee flexion to increase positional strength. The Romanian deadlift on the suspension system is an excellent beginner drill to reinforce the hip hinge movement pattern for improved range of motion. Start in front of the anchor point with the hands on the straps, the chest up, the knees unlocked, and the spine neutral. Pull down on the handles as you slowly reach your hands forward while flexing at the hips. Keep the spine neutral and the knees should remain slightly flexed, but incur no additional movement. Ideally, you can flex your hips until the spine is parallel to the ground. To adjust the exercise for greater difficulty, simply raise one leg posteriorly by reaching with the heel. The hip should not rotate, as evident by the toes pointing to the floor rather than outward. Common errors during the Romanian deadlift include flexing at the knees more than necessary. Either cue to keep the high hips, push the hips back and up, or allow the exerciser to get into the bottom position and then cue them to extend their legs to raise their hips. This allows them to find their ideal finishing position. Rounding of the back. Cue the client to raise their chest. And disconnect on the descent or ascent. If you see the shoulders and hips are flexing or extending out of sync, slow the movement down and have the client pause every 3 to 4 inches. Now let's look at the lateral lunge pull exercise. The lateral lunge pull can be performed statically or dynamically. For the easier static option, start in a wide stance, holding the handles using a neutral grip with your elbows below your shoulders. Descend to one side while keeping the opposite leg fully extended. Your hip and knee should be flexing at the same rate. As you drop to one side, keep tension on the straps. Return to the standing position and repeat to the other side. For the dynamic variation, you will start with your feet together. Take a large step lunge directly out to the side. Descend until the hip is below parallel with the floor, or as far as flexibility allows. Return to the start position by pushing off ballistically with the flexed leg while pulling on the straps for support. Common errors during the lateral lunge pull include hip translation during the eccentric phase. Cue your clients to brace the trunk as they descend, providing further visual or tactile cueing as necessary if the hips continue to translate, and failing to descend through the full range of motion due to frontal plane tightness in the hips and thighs. Let's progress by looking at power skips. This exercise will take some adjustments to find the correct starting position based on individual anthropometrics. Start by facing away from the anchor, using a neutral hand grip with the straps between your upper arms and torso. Next, lean forward into a falling position and then raise one leg. You should be in a forward position under the tension of the straps. Place the raised back foot on the ground in a staggered step and maintain the lean forward stance. From this position, press your weight into the straps as you perform a power skip. Your hip and knee should extend simultaneously, and your trail leg will flex into a high knee position. If needed, do not perform the jump but simply plantar flex at the top of the lunge. Smoothly reverse the movement and repeat before switching sides. You can also perform this movement with a ballistic leg swing with the knee extended. Common errors during this exercise include poor rear foot placement. The foot should be neutral and dorsiflexed until the heel is in contact with the ground, and not extending the hips and/or knees. Some clients will jump without extending either joint. This might be due to them not feeling comfortable using the suspension system. Regress them to perform the movement using a squat rack or wall for support. Let's now examine a complex movement, the pull-over Nordic hamstring exercise. Depending on the setup, you may or may not need a partner to hold your ankles. Start from a kneeling position with your hips extended. Slowly extend the knees and reach your hands forward while keeping a rigid trunk position. Maintain tension on the handles throughout the movement while forcefully extending the hips. Continue to extend your knees and flex your shoulders until the shoulders are fully flexed and knees are almost fully extended. Remember, it is vital that the hips remain fully extended throughout the lift. To return to the start position, simultaneously flex the knees and extend the shoulders with rigid arm extension. Your hamstrings and lats should fire at the same time for fluid movement. Common errors for this exercise include flexing the hips at any point throughout the movement. Cue the client to contract their glutes. Shortening the range of motion may be necessary if this error still occurs. And poor movement fluidity due to shoulder discomfort. For this, you can switch to a neutral grip with the outside of your hands on the handles. Let's finalize our review of functional exercises by examining a few applications for the trunk, starting with the pole rotation reach. From the row start position, hold both handles in the same hand at the top position of a neutral grip row. Reach the opposite arm straight in front of you. Start the movement by slowly dropping out of the low row. Rotate your trunk and perform a squat. This should happen slowly and in a synchronized fashion. Return to the start position by extending your hips and knees while rotating and rowing back to the top. If this movement is too difficult to perform, walk the feet further away from the anchor. You can also modify this movement to only include the rotational reach, with the elbow extended at the start position. The suspension device allows for a variety of pike exercise variations. But before you instruct a client to perform pikes with their feet in the handles, have them perform the trunk flexion drill. From the push-up position, flex your trunk as much as possible to draw the handles toward the hips. Slowly return to the start position. This movement should be mastered before greater ranges are attempted. To perform the full pike exercise, start by placing your feet through the handles. Assume a high plank position with the legs adducted and the straps hanging vertically over your feet. Focus on flexing your rectus abdominis, having your hips raise as a byproduct, not as a mover. Your feet should slide effortlessly straight as far in as possible. If that is too difficult, flex your knees as you flex the trunk. This is easier as the resistance arm is shortened and there is less resistance from the low back and hamstrings. A modification of the pike with knees flexed is to include hip abduction during the concentric portion of the movement. To reduce the need for higher levels of flexibility, cue clients to bring their knees outside of their elbows. Make sure you are returning to the same start position for each rep. The knees flexed or extended pike can also be performed with trunk rotation. As you perform this variation, flex both knees and make sure the opposite knee finishes outside of the alternate elbow position. Return to the same start position and transition to the other side. This activity should flow back and forth without transitional rest. Let's now examine a number of exercises that are performed while facing away from the anchor, starting with dips. While dips can be performed on a variety of implements, added stability requirements to the shoulders when performed using a suspension system can provide utility for anyone looking to improve functional upper body strength. Start by grasping the handles and descending the trunk to stabilize the entire body's weight through the shoulders before walking the feet forward. The straps are more comfortably held outside of the arms, even though it adds to the stability challenge of the exercise. The arms should be fully adducted against the sides of the body. Initiate the movement by stabilizing the trunk with an extended thoracic spine. Next, slowly drop the hips straight down. while keeping the chest elevated throughout the descent. The bottom position is determined by shoulder range of motion. The movement should stop just above the point where the shoulders roll forward. Upon reaching the bottom position, start the concentric portion by pushing through the palms of the hands until the elbows are fully extended and shoulders return to their starting positions. Common errors during suspension dips include having the chest concave and shoulders roll forward. This is a contraindicated position for dips on any implement. This position would put excessive stress on the shoulder capsule. Constantly cue to keep the shoulders back and keep the chest elevated. And lack of control at the shoulder joint. Stabilizing the handles can be very difficult for some clients. Cue them to pinch their hands in, or provide a slight tactical cue on their upper arms. Similar to upper body rows, upper body pressing exercises require the maintenance of a neutral body position. The spine will be held in its natural S-curve with the hips and head neutral. Cue your clients to be as straight as a pencil. If the hips are flexed, the exerciser should contract their glutes to get the hips neutral, while bracing the inner unit to avoid an increased lordotic curve. These movement errors tend to be more common in the prone start position versus the supine position of the rows to help gain stability and mechanical advantage. For press and extension exercises, the hands can be pronated, neutral, or somewhere in between. The preference for most movements is to start with the hands halfway between fully pronated and neutral. This position is easy on the shoulders while still providing similar activation patterns, and can easily transition into a neutral, pronated, or supinated grip position. Common errors for the start position during upper body presses and extensions include saggy hips, which can be fixed by engaging the core musculature; high hips, which requires extending the hips by contracting the glutes; forward shoulders, which can be fixed by cueing chest elevation; feet that are positioned too wide. Ideally, the feet should be hip-width apart if possible; and flexed elbows. Individuals that struggle to stabilize through their shoulders might try to flex their elbows to gain stability. Cue them to contract their triceps. Let's start by looking at suspension push-ups. Once the start position is obtained, initiate the movement by slowly retracting the scapula and simultaneously flexing the arms to lower the body. The forearms should maintain proximity to the body but not touch it, as this would reduce chest activity in exchange for increased activation of the triceps. During the descent, continue to keep the head and hips neutral with the chest elevated until the terminal range of motion is accomplished. At the bottom, one should feel a slight to moderate stretch of the pecs while keeping the shoulders pulled back and the wrists held neutral. Initiate the concentric portion of the lift by pushing through the palms, extending the elbows, and flexing the shoulders, while maintaining a rigid plank position until you return to the start position. From the side, it should look like the body is only pivoting on the toes with just the shoulder and elbow joints experiencing any change in length. Common errors of the push-up include having the hands go too wide or close to the body, practicing bench push-ups first and verbal cueing can reinforce the proper humeral angle, allowing the shoulders to migrate forward. This anterior movement is due to instability and places extra stress on the shoulder capsule. It should be avoided by cueing the client to keep their chest up and shoulders back as they descend, and allowing the shoulders to abduct. This is similar to too wide of a position and is often caused by poor stability at the shoulder joint. You can work on fixing this pattern by switching to a neutral grip, as that will keep the upper arms closer to the body. Modifications of the push-up can include performing them with knees on the floor or using a higher angle, which are both useful for beginners. Or half-fly push-ups. The half-fly push-up is advanced as it increases the stability required at all segments of the body. One arm remains extended as you descend into a push-up. You can either go into a T position or an I position with the straight arm. Let's now take a look at suspension flies. The best part about using a suspension system for chest flies is the variable resistance. You can easily modify the end position to either increase tension by going wider or decrease tension by going narrower. The start position is the same as with the push-up, but always employs a neutral grip. Start with slightly flexed elbows, just like you would with dumbbell flies. Initiate the movement by horizontally abducting the shoulders while retracting the scapula. Keep the wrists neutral during the descent into the bottom of the movement. If the tension is too great, attenuate it by increasing elbow flexion to make it easier. The handle should be even or just behind the chest in the bottom position. You may feel a moderate to high stretch on the pecs. Finally, initiate the concentric portion of your lift by focusing on squeezing your pec musculature while elevating the chest and bringing your hands together in front of you like you are trying to hug a barrel. Common errors of the suspension fly include all of the similar positional errors as the push-up, such as low or high hips, poor foot placement, and too much elbow flexion. Straying of the hands out of the proper plane of movement. The hands should stay even with the interior aspect of the shoulders. If the hands stray, it will put extra stress on the shoulder joints and potentially too much strain on the pecs. Let's now review tricep extensions. Start by grasping the handles with a pronated grip and walk out until you reach straight arm tension. Then flex the shoulders and elbows to around 90 degrees. Next, extend the elbows, keeping the palms facing forward. When complete, reflex the elbows to the start position. This movement can be used to isolate the triceps by not allowing the shoulder joint angle to change, or you can integrate the lats and triceps by treating the movement like a pullover. Neither are right or wrong. It just depends on the programmatic goal. Common errors during suspension tricep extensions include not completing a full range of motion, allowing the elbows to flare out for mechanical advantage, and flexing at the shoulders to assist the movement. In the category of pulls, the IYT reaches are included. They can be considered progressions from the traditional suspension row as they use similar biomechanics with a longer resistance arm. Even though they use similar joint musculature, they are much more demanding, requiring higher requisite strength and mobility to perform them correctly. The reaches start using a higher vertical angle due to the decrease in mechanical advantage. The body hangs from outstretched arms at an angle between 45 to 60 degrees. Holding the handles using a pronated grip, the I-reach movement is initiated by flexing the shoulders. It is recommended to visualize reaching the back of the hand straight up for smooth mechanics. The elbows should not flex. Actively contracting the triceps can assist in keeping the arms straight. Keeping the body straight, continue to reach the hands toward the sky. This will pull the body upwards until full shoulder flexion, at 180 degrees, is obtained. Hold this position before initiating the descent in a slow, controlled manner through the full eccentric contraction. The Y-reach follows a similar pattern, but varies by arm width, so the finishing position resembles the letter Y. Instead of raising the arms straight up, visualize spreading a band apart as you flex your shoulders. This exercise incorporates more mid and lower trapezius. So, as this occurs, actively depress the scapula. The hand position at the top of the movement should resemble an overhead squat. And, just as with the eye reach, initiate the descent slowly and in a controlled manner. The T reach further changes the exercise to incorporate more rear deltoid and rhomboids. Rather than starting in a pronated grip, the hands should employ a neutral grip to match this goal. Keeping your elbows fully extended, spread your hands apart through horizontal abduction while keeping your thoracic spine extended, ensuring the chest is properly elevated. Continue activating the rhomboids by pulling the straps apart until your hands are even with or behind your shoulders. At the top position, your head should remain neutral while your torso and arms form a perfect T. The hands should not be above or below shoulder height. Finally, control the descent, returning to a start position and pronating your hands to prep for the subsequent eye reach if performing all three actions in a sequence. Common errors during the IYT reaches include flexing the elbows or hips to gain mechanical advantage. Here, one should first attempt to talk them through any corrections. If verbally cueing the exercise to keep their elbows or hips extended is ineffective, then have them bring their feet further away from the attachment site to lighten the relative load. Flexing at the neck or reaching the head forward. This is usually easily corrected with a cue to keep the head back and raise the chest. And descending too rapidly. This can cause you to lose control of the movement. If the exerciser cannot control the descent, move the feet further away and slightly widen the stance. Let's continue by examining pull-aparts. From the row start position, initiate the movement by simultaneously flexing the shoulders and elbows. This combined action will make the handles travel in a gentle arching pattern, separating the hands from chest height to eye level. As the handles rise, the scapula retract to pull the shoulders back. They should not internally rotate. The wrists remain neutral throughout the movement in a pronated position. Pause for 1 second at the top of the movement before controlling the eccentric portion and returning back to the starting position. Face pulls increase the action of the trapezius, providing some mechanical advantage from the modified angle and a reduced range of motion, thereby acting as a regression from the full pull-aparts. Introducing high-angle face pulls allows newer exercisers the capability of thoracic muscle activation and scapular retraction without the requisite strength to complete a full row. Emphasize scapular retraction, potentially holding the top position for 2 to 3 seconds on each rep. This allows the client to become familiar with the terminal pull portion of the lift. Common errors of both movements include letting the shoulders anteriorly migrate during the pull. Here, verbally cue the client to pull their shoulders back or provide a tactile cue on their posterior deltoids. Cueing shoulder blades back and down and puff the chest up when you pull can also help with proper exercise positioning. And pulling too narrow. The hands should not only go up but slightly wider. This allows for greater emphasis on the posterior deltoids and traps. Low pull-aparts assume the same start position as the other rows, but for transverse actions below the shoulders, exercisers can assume either pronated or supinated hand positions. For the M pull-aparts, the motion starts with simultaneous horizontal abduction of the shoulder to pull the handles apart and down, while retracting and depressing the scapula. Smoothly continue this motion until the arms have been fully abducted and extended past your trunk. The chest should be elevated throughout the movement and the shoulders pulled back. At the terminal reach point, hold for 1 second, then slowly reverse the movement to return to the start position. Due to the closed pack position of the shoulders, exercisers often find this easier to control than other pulls. The alternating cross pull-apart is a fun variation of the M pull-apart and Y reach. From the same starting position, the arms reach in alternate directions as one arm will pull downward while the other arm raises upward in the transverse plane. The movement should occur simultaneously, with the upper and lower arm each reaching their terminal position at the same time. It is important to keep a rigid core to prevent any alternate pull force imbalance. From a rear view, the two arms should be in a continuous line at the end position. Now, bicep pulls are a functional isolator and used to incorporate specific bicep work into a program. This movement is initiated from a similar start angle, but always with a supinated grip. The thoracic spine should be extended and core rigid to optimize bicep activation. The movement is initiated by flexing at the elbows. As full elbow flexion is reached, continue the movement by flexing at the shoulders so the elbows arch above the head to a finishing position with the shoulders fully flexed and hands behind the head. Return to the start position by slowly extending the shoulders and biceps until the arms are fully extended, re-attaining the starting position. Common errors for bicep pulls include failing to coordinate the movement sequence. The biceps should generate enough force to carry the momentum into shoulder flexion. This is actually a ballistic bicep curl. And failure to go into full shoulder flexion. While this is conditional on having adequate latissimus dorsi flexibility, clients should be cued to go into full flexion. Having them hold the position to feel the stretch in their lats can help them understand the purpose.